Should doctors be allowed to pray with their patients? Can they share religious convictions with them? Or should they refrain from talking about their faith? In this video, I'll cover two arguments that doctors should not be allowed to have substantive religious conversations with their patients. Two bioethicists, Lauren Notini and Justin Oakley, argue that it is impermissible for clinicians to have substantive religious discussion with their patients for two reasons. First, it's impractical to require that physicians engage in such discussions. And second, to engage in substantive religious discussion goes beyond their role as medical professionals. Now, to be clear, the authors are not arguing that it is wrong to engage in any religious discussion with their patients. Asking the patient about her values, including religious values, or referring her to a religious expert would be okay. Rather, they claim clinicians are not morally obligated to engage in any religious discussion that goes beyond these basic interactions. The authors consider any conversation more involved than this to be substantive religious conversation, and it is wrong, they argue, to have substantive religious conversations with patients. So the authors intend to make two distinct claims. First, that clinicians are not obligated to have substantive religious conversations with their patients, and second, that it would be wrong for them to engage in such discussion. The authors build their case for the first claim starting with the following idea. Clinicians aren't obligated to provide non-medical services that would be impractical to provide. For instance, clinicians don't have a moral obligation to provide housing for homeless patients. Perhaps they have an obligation to point them to places to live during a difficult time, but it would be quite impractical to require them to actually be the ones providing the housing. In the same way, it's impractical to obligate clinicians to discuss religious beliefs with their patients because a basic knowledge of religious belief would take an extraordinary amount of time to master. Not only would clinicians have to go through extensive training in or beyond medical school to gain even basic conversational knowledge of major world religions, but they would also lose time in the clinical or hospital setting that could be used elsewhere. So here is their first argument. If some non-medical service is impractical to provide, then clinicians are not obligated to provide that service. It is impractical to engage in substantive religious discussion with patients. Therefore, clinicians are not obligated to engage in substantive religious discussion with their patients. But if clinicians don't have an obligation to have such discussions, shouldn't they at least be allowed to do so? What would be wrong about talking to your patient about the existence of God? What would be wrong about praying for your patients when they accept your offer to pray for them? According to Notini and Oakley, it would be wrong to engage in such conversations with patients or pray for them because those discussions fall outside the proper scope of medicine. The goal of medicine, they suggest, is to use tools within the profession to promote the well-being of the patient, whereas taking x-rays and providing abortions may achieve those goals by means of medical technology. Talking to patients about God or praying for them does not. So their second argument runs like this. It is impermissible for clinicians to provide services beyond the scope of the medical profession. Engaging in substantive religious discussion with patients is beyond the scope of the medical profession. Therefore, it is impermissible to engage in substantive religious discussion with patients. So, not only do they conclude that clinicians do not have an obligation to engage in substantive discussion about religion, but also that it would be wrong of them to do so. Thanks for watching 5 Minute Ethics. Please like and subscribe.